The Therapeutic Goods Administration is the medicine and therapeutic regulatory agency of the Australian government. As part of the Department of Health, the TGA regulates the quality, supply and advertising of medicines, pathology devices, medical devices, blood products and most other therapeutics. Any items that claim to have a therapeutic effect are involved in the administration of medication or are otherwise covered by the Therapeutic Goods Act 1989, the Therapeutic Goods Regulations 1990, or a ministerial order, must be approved by the TGA and registered in the Australian Register of Therapeutic Goods. In Australia, medical products are regulated by the TGA and, for controlled drugs such as cannabis, the Office of Drug Control. Together the TGA and ODC form the Health Products Regulation Group within the Department of Health. The Health Products Regulation Group comprises 11 regulatory branches and 1 legal branch, organized into 3 divisions. The Regulatory Services and Drug Control branch is the only one to not be part of the TGA. The TGA also includes 7 specialized statutory committees, which the agency can call upon for assistance on technical or scientific issues. 4 other committees also exist to give guidance on annual influenza vaccines, industry consultation matters, and the Therapeutic Goods Advertising Code. In September 2003, the Australian and New Zealand government signed a treaty to establish a common therapeutic regulatory agency for the 2 countries. Australia-New Zealand Therapeutic Products Agency, as it was to be called, would replace the TGA and MedSafe, the national regulator in New Zealand. In June 2011, 8 years after the original treaty, Australian Prime Minister Julia Gillard and New Zealand Prime Minister John Key signed a letter of intent, reaffirming plans to create such an agency. In November 2014, both Australia and New Zealand agreed to cease plans to create a shared regulator, citing a comprehensive review of progress and assessment of the costs and benefits to each country. The joint statement announcing the cessation outlines that both the TGA and MedSafe would continue to cooperate on medicine regulation and that the New Zealand government would still participate in the now defunct Council of Australian Governments Health Council. On the 25th of January 2021, the TGA provisionally approved the 2-dose Pfizer-BioNTech COVID-19 vaccine, named COMIRNATY, for use within Australia. The provisional approval only recommends the vaccine for patients over the age of 16, pending ongoing submission of clinical data from the vaccine sponsors. Additionally, every batch of vaccines will have their composition and documentation verified by TGA laboratories before being distributed to medical providers. The Department of Health has planned the administration of COVID-19 vaccinations in 5 phases, organized by the risk of exposure, border, quarantine, and frontline health and aged care workers will be first vaccinated, followed by over 70-year-olds, other healthcare workers, and essential emergency service members, following the provisional approval of COMIRNATY. Prime Minister Scott Morrison said that it was planned for the first group to begin vaccinations by February 2021, 6 weeks earlier than originally planned. The first public COVID-19 vaccination in Australia actually took place on the 21st of February 2021 with the Pfizer-BioNTech vaccine at Castle Hill in Sydney. An 84-year-old aged care resident was the first Australian to receive the vaccine. To show confidence in the national immunisation vaccine rollout, Prime Minister Morrison and Chief Medical Officer Professor Paul Kelly also received vaccinations. On the 23rd of February 2021, Australia's second shipment of the Pfizer vaccine arrived at Sydney Airport. Health Minister Hunt confirmed the arrival of 166,000 doses, and 120,000 more doses expected to arrive in the upcoming week. On the 16th of February 2021, the Oxford AstraZeneca vaccine was approved by the TGA for use in Australia. The administration of this vaccine is scheduled to start in March. 2 weeks later, on the 28th of February, the first shipment of the vaccine, around 300,000 doses, arrived at Sydney for rollout from the 8th of March. On the 5th of March 2021, Italy stopped the export of AstraZeneca vaccine to Australia due to their slower rollout of that vaccine in the EU.